Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. Today's show is called Dr. Jeffrey Tauth YT, Strength versus Cardio Heart Showdown, and trust me, it's juicier than your cousin's peach cobbler. You know what drives me absolutely bonkers? When patients walk into my office and tell me they've been running themselves ragged on treadmills for months, wondering why their heart health isn't improving the way they expected. Here's the kicker, most people think cardio is the undisputed heavyweight champion for heart health, but new research shows lifting weights might be equally powerful. And folks, that changes everything about how you should be thinking about your workout routine. Let me tell you something that might shock you. For decades, we've been pushing this cardio-centric approach like it's gospel. Running, cycling, swimming, see, these dominate every doctor's recommendations. I get it, I really do. There is something beautifully simple about telling someone to just go run around the block. But here's what we missed, and I mean really missed. Cardio only trains one aspect of your cardiovascular fitness. Think of your heart like a Swiss Army knife. Cardio basically just sharpens one blade while leaving all the other tools dull. We were so focused on getting that heart rate up and keeping it there that we completely ignored how strength training builds heart muscle in an entirely different way. It's like we've been trying to build a house using only a hammer when we had a whole toolbox sitting right there. Now here's where it gets really interesting. Strength training lowers blood pressure just as effectively as cardio. Yep, entirely true, I can't make this stuff up. But it doesn't stop there. When you're lifting weights, you're building lean muscle mass, which cranks up your metabolism like a turbo engine. You're also reducing those nasty inflammation markers that are directly linked to heart disease. The beautiful thing about strength training is it creates a completely different type of beneficial stress on your cardiovascular system. While cardio is like taking your heart on a steady highway cruise, strength training is like interval city driving, short bursts of intense work followed by recovery. Both teach your heart valuable lessons, just in different classrooms. Studies are showing us that just 2 to 3 strength training sessions per week can match the cardiovascular benefits we used to think only came from endless cardio sessions. If that doesn't make you want to pick up some dumbbells, maybe I should see you in the clinic. We need to talk. Let me share a real-world example that'll knock your socks off. I had a patient named Sarah, a 45-year-old teacher who was constantly stressed about not having time for those hour-long cardio sessions everyone kept telling her she needed. Sound familiar? Sarah switched to 20-minute strength workouts 3 times a week. That's it. 3 times a week, 20 minutes each. After 6 months, her blood pressure dropped 15 points, her resting heart rate improved significantly, and here's the kicker. She felt stronger and more energetic than she had after years of sporadic cardio attempts. Sarah proved that strength training isn't just about building biceps to show off at the beach, it's legitimate heart medicine. But here's the plot twist you've been waiting for. The absolute best approach isn't choosing team cardio or team strength training like you're picking sides in some fitness civil war. The real winner is combination training. Your heart doesn't want you to choose favorites. It wants variety like a kid in a candy store. I recommend aiming for 2 to 3 strength sessions plus 2 cardio sessions weekly. If you're new to strength training, don't worry about looking like a bodybuilder on day 1. Start with bodyweight exercises, squats, push-ups, rows. Focus on compound movements that work multiple muscle groups because they give you the biggest bang for your buck. Even 15-minute strength sessions provide measurable heart benefits. 15 minutes? That's less time than most people spend scrolling through social media during their morning coffee. Here's your actionable takeaway that I want you to implement this week. Replace one of your regular cardio sessions with 20 minutes of strength training. Your heart will thank you for the variety, and honestly, you might discover you actually enjoy lifting weights more than you thought you would. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.